We had a very good 2 days workshop where we bring different partners together to talk about One Health. So I'm very impressed to see the active engagement of different sectors here. So we met 4 executive officers of health, agriculture, cooperative, trade, sitting together, talked about One Health. And I will always mention that this is very important, the intersectoral collaboration to make One Health a success in addition to other partners working on the ground. So this meeting is the second meeting to meet with partners of Narok County One Health platform. So we organized the first meeting some time ago, and we want to follow up. We want to come here to review the progress, but also to update partners the research that we have been doing with Narok County partner, in particular DVS and public health sector. This is very timely because the pandemic of COVID-19 is causing a lot of problems, and the research on zoonotic disease is important in addition to the topics of antimicrobial resistance and also food safety, all relevant for this county.
In Narok County, we are a unique county that has a strong interface, very active interface between humans, wildlife, and livestock. And therefore, the One Health approach becomes very critical in making sure that we protect the health of humans, animals, and the environment.
And out of this workshop, I've met my expectation that our people are informed, they will be informed, and from now, even henceforth, we'll be able to implement most of the information or the teachings the workshop has brought to us.
The workshop was just great. These workshops, since morning, you see, we gave expectations. And nowadays we rank expectations as met expectations, exceeded. This one exceeded expectation in the sense that the presentations and the presenters themselves are very articulate, science-based, and then it is customized. In fact, as they are trying to demonstrate, as they are trying to, the presenters are trying to bring out the findings, the research that has been carried out, it brings closer to carried out in Narok. It brings us closer home.
Yeah, we plan to continue working together to come on board and mobilize for resources, plan together, do research, share our findings, and even mobilize our communities towards the importance of working as one.
We believe that future prospects for this approach is good. And we believe that moving forward, we shall begin to see a more capacitated platform in terms of technical capacity, in terms of information and data, in terms of partners, in terms of communication to the communities, in terms of all activities that ensure that there is proper prevention of zoonotic diseases and safe food, safe environment. We believe that in the near future will be a leading county One Health platform in this country.
So next step would be really we advise and suggest and support One Health platform in Narok to formalize this structure. So they should come up with a decision at the county level to formally establish this One Health platform at county level. And at the same time, we talk about different possibilities to develop partnership with research institute, university, including ILRI, to assist Narok to really promote One Health approach. Not only promoting this approach, but really, practicing, implementing, operating this approach on the ground. For the reason I talked before, and hopefully all this action will be quickly be implemented, and ILRI as institutional support partners very happy to support Narok County to strengthening and collaborating with this platform in terms of One Health research, but also practice and implementation activities.